If you are very concerned with the aging process in your face, there's an easy way to deal with that. We have from minimally invasive procedures, a fat transfer that we can discuss in another video, versus doing fillers, mid-face fillers. For example, we use usually a permanent filler called Artefill to enhance the volume in the middle of the face, the nasolabial folds, under the eyes, the malar prominence. These fillers give you a much more youthful result with a 10-minute procedure with minimal downtime and really no pain during the procedure. That's a non-invasive way of performing facial rejuvenation. Now, facial rejuvenation entails many different aspects. I would say that the main areas in our face where we show the aging process are around the eyes and in the neck. For the eyes, the main problem is when the upper eyelid is starting to sag, and when, if genetically somebody in your family has eye bags, you will probably also develop them. For that, we can do a procedure called a blepharoplasty. For the upper eyelid, it's a skin incision in the crease area where we remove the excess skin, sometimes the excess fat, mostly in the inner canthus here. And with that, we can give you a very nice, easy procedure with stitches that we remove at 6 days after the procedure, and with a scar that is minimal after a few weeks, and it's in the crease where it's going to be almost impossible to see. Now, for the lower eye bags, we do a procedure that is called transconjunctival blepharoplasty. So we go inside your eye and we incise the conjunctiva with a cautery. All this with local anesthetics and mild sedation. So you are not under general anesthesia. We don't do general anesthesia, Ciao for any procedure. And through that, we remove 3 pockets, one in the middle side close to the nose, one here in the center, and one lateral. Once these 3 bags are removed, we evaluate if you have excess skin here. If you have too much creepy skin here or too much skin, we do what's called a pinch blepharoplasty, where we do a little incision just under your eyelid here in the center, 5 millimeters from the eyelid here in the outer canthus. And with that, we pinch the skin that is excessive, we cut it, and we stitch it together, removing the stitches in 5 days. With this procedure, the rejuvenation around the eyes is profound and the complications are minimized. The main thing that I want to make sure is, if I'm going to do a transconjunctival blepharoplasty, is that you are not on any medication, herbs, or supplements that can increase bleeding, because if you have a bleed, it's inside the eye, and that's a dangerous place to have a bleed. So we have to make sure that if you are going to get this procedure done, that you are not on vitamin E, ginkgo biloba, high garlic dosages, blood thinners, aspirin, anything like that. We have to stop that at least 2 to 3 weeks before the procedure. And for recovery, we make sure that you are not having high blood pressure, that you are not doing any strenuous activity that would trigger a bleed. If you follow all our instructions, the possible complications of this surgery are minimal. You still will get your informed consent where all the possible complications exist, and we want you to discuss them very thoroughly with us so you understand what you are getting into and what your possible outcomes are going to be. If it's not around your eyes that you have concerns, but it's also your jaws area and your neck that are starting to sag, a facelift procedure will be probably the most appropriate. A facelift deals from the eyes down to the neck. It's really more of a mid-face and neck lift than the whole facelift. The facelift entails a scar that is usually hidden here in the bearing area, going down the eye, behind the tragus, and then up behind the ear, and again back into the hair bearing area here. Once we do that with local anesthesia, we detach the skin that we're going to get rid of, and the muscle that is in your face is called the SMAS, superficial musculoaponeurotic system, and in your neck is called the platysma muscle. Sometimes we have these platysma bands, that is bands of muscle that are protruding here in the center, in which case we might have to also do a little incision just below your chin, 3 centimeter incision. Through these 2 incisions, we tighten your muscles in the face and in your neck, pulling it in vectors that are as natural as possible, usually superlaterally, and these are done with permanent braided sutures that we put in the muscle itself, pulling the muscle up, this mass here and the platysma here, and with this we create the main tightening effect for the facelift. The tightening is in the muscle so we can get the most natural result, not a surgical result. After we have tightened the muscles, we pull the skin back and we see how much skin we have to remove. We're very conservative, so we create not a windswept look that looks like you had surgery, that's really ugly. And we avoid tension on the scar, so we get a scar that is almost imperceptible after a few weeks. This procedure is about 3-4 hour procedure to a real complete facelift, not one of these marketing promoted facelifts that are really not a very thorough and complete procedure. And with this we can give you on average 8 to 10 years of duration of improvement. Many times you will look way younger than before, and we are usually very happy with the results of our patients. We've had many cases where really the changes have been dramatic. Patients ask me, how long can this last? I tell my patients, if you have a twin sister and you get the procedure done and she doesn't, 10 years from now, you are still going to look much younger than she does. But of course, the passage of time, the damage with the sun, will cause more skin laxity again, that you might need a second, less aggressive facelift probably to continue keeping the same looks. The facelift procedure has risks. The main one is causing infections, bleeding, damage to the nerves. This nerve here, the greater auricular nerve, can be damaged, that we try to avoid in all our cases. We never had a case where we had damage to that. Facial nerve damage, we avoided doing the supra-SMAS technique, so we don't really have problems with the facial nerve at all. But you will feel numbness after your procedure for a while, month, 2 months. The skin we feel tight for a while. You will some swelling. Occasionally you will have some bruises, but usually recovery is not too bad. Most of our patients go back to work within a week after their procedure, and the pain is relatively minimal. We encourage you to read the consent form very thoroughly when you get it by email or fax, and then on your pre-op we will answer every single question about the possible complications and risks with the facelift, and we will have shown you already many before and after pictures of cases that are very similar to your situation, so you can have realistic expectations of how your results are going to be. If your concern is that you have also very significant brow droopiness, we might have to do also a brow lift, in which case we do what's called a trichophytic incision here at the hairline, just 5 millimeters behind. We do a very oblique incision so the hair can grow through the scar, and then we lift the brow in such a way that we decrease these lines that form in the brow area. Many times we also do a muscle excision of the procerus and corrugator muscles here to decrease these lines that some people call the 11s during that same brow lift surgery. And with this we can get a real complete rejuvenation of the face. In some patients, I advise to do laser resurfacing after the facelift to enhance the tightening of the skin and to improve the quality and thickness of the skin with a fractional CO2 laser resurfacing. That causes a little bit more swelling after the procedure, but usually within 5 to 7 days you are able to go back to work. Thank you.